Hi, good afternoon. This is Ira Sahai on a very interesting Wednesday afternoon. I am the media head of dLife. I'm a metabolic health coach and a member of dLife. dLife is India's oldest, biggest, and the only award-winning low-carb platform, from where comes the dLife Diploma course in low-carb nutrition and metabolic health. I have with me today Dr. Sandeep Karagada, who is a dLife member, a certified metabolic health coach, and is a homeopathic doctor in private practice for the last 15 years. He also helps people quit smoking. He got interested in nutrition when he personally tried the paleo diet in 2013 and saw tremendous changes in himself. He always thought of diet as complementary to medications, but after following some dLife members and other metabolic health coaches on Twitter, he started advising patients on diet and started seeing results on them too. This finally made him decide to sign up and study the dLife Diploma course. He says after doing the dLife Diploma course, he now knows that dietary changes are not only preventive, but also curative in so many diseases. Welcome, welcome, Dr. Sandeep. How are you today?
Good afternoon, Ida. I'm well, thank you. Excited to be a part of this of dLife, and really excited to give my review about the course because I just recently completed and have a lot of good things to share.
So, how do you feel about being called a legally certified metabolic health coach?
Well, actually, today was the first time I heard someone say that and refer that to me. I honestly got goosebumps all over me because when I received my license to practice homeopathic medicine, that was over 15 years ago, and this is probably the second diploma. I mean, there was another diploma in homeopathy I did, and this the other diploma I've done after a very long time. And I have to say, this is among the top things that I've ever read professionally to help my patients. And actually, helping patients is a was not the direct idea. The idea was to really help myself, but I have learned so much that I'm able to contribute to almost every patient who comes to me.
Sandeep, you are a homeopathic doctor already. Why did you, feel the need to study nutrition? Of course, I know your background, trying the paleo diet and all, but was that the only reason or something else?
Well, see, I would get patients, a good majority of my patients would get better with the medications, but then they would come back after some time. This is true definitely of recurrent gastritis episodes. Also with certain autoimmune disorders like psoriasis, they would get better and they would come back. And then you would always put it to, okay, maybe the action of the medication has got over, maybe it was stress, and that's the reason there's a relapse. But I really did not have anything much concrete to offer them in terms of a remedy other than actually putting them on homeopathic medications again. And many times the cycle would repeat. Uh, so when I came across certain information, I realized that maybe there is a lot more I can offer to people so that they don't have to be on dependent on medications completely. Uh, I had access to information thanks to internet for the last 10, 15 years, but the information was never put across to me, or I did not put the I have the means to really get the information in a way that I could professionally advise people. Apart from the standard, see, right from my internship back in 2006, the advice that I would give people is, any diabetic would come to me, I would tell them, ki, rice mat khaiye, have ragi, or certain things like avoid sugar, but jaggery is good. These are the things which I've been advising people for a long time. And it makes the patient happy, right? They leave happier. But at the end, the result is not showing up. The blood work remains the same. So there's only so much that you can do with the information that you get from your college.
I stopped. Okay, continue. Yeah.
Yeah. So after I consulted the dietitian for my elevated uric acid, I was told to cut down on protein, and all the good benefits that I got from paleo actually went away. And that's the time I started going off paleo. I reduced my intake of proteins. I did intermittent fasting, but without the adequate protein, intermittent fasting wasn't helping me. My uric acid levels remained the same. And that is when I came across a few posts by Shashikant Iyengar on Twitter about uric acid getting elevated because of fructose, glucose. That didn't make sense at all, because all these years I've been telling people your uric acid is high, cut down on proteins. And one of the arguments in favor of this was that as Indians, we hardly eat even the recommended allowance of protein. So why should our uric acid go high? And that really made me more interested to know more about it. I did shop around online a bit to see which course would probably be ideal for me. So dLife was one of them among the best ones there. But there were also a few from some places in US and in Canada. But when I went to the dLife website and I saw what the atmosphere was, the atmosphere being that the forum, the access that you have to the mentors, the literal hand holding that can be done. I was really impressed by that, because I've always been with my homeopathic colleagues. I've always been behind them. Okay, let's come up with a way that we can connect and we can share our experiences and grow together. But that always stays an idea. It didn't really actually materialize. But then I saw that if I had an access to something like this, when my dietitian told me to go off paleo to cut down uric acid, maybe I wouldn't have had to do that. Maybe I wouldn't have had to fail at my attempt at intermittent fasting. And that made me sign up for dLife. I'm so happy to say that I made the right decision. It's been sort of 11 months ago that I signed up. And the course module, the way it has been structured is just so wonderful. I have reread a few things which didn't make sense to me. I have paused videos. I have I have skipped certain bits. Of course, I should not be. I should confess here that I'm not really good with chemistry. So wherever the chemistry bits came in, I had to skip through that. But the whole idea of the course, that at the end of it, I am much more well versed with how I can guide people achieve long-term health. That has got really ingrained. And I wish I could have done something like this a bit earlier, because it's of course I've seen thousands of patients in these years of practice. I could have contributed a lot more. I could have contributed a lot more with my family is also what I believe, because all of us have people who are growing old in our families, and the first thing that when they start growing old is we cut back on a lot of things. We cut back on fats, we cut back on protein, and I realized what a big mistake we have been doing all along. And see, I had come across information earlier also, but you tend to overlook it, or you tend to push it aside, because this is new information. You don't really, there's a part of you which wants to believe it, but a part of you says maybe this is not true. But then you go on the forum and then you see people, the mentors, their own case studies, their own success stories, and that is more evidence than I could ever ask. These are the reasons why I truly believe that one of the best things that I've done is to enroll as a member at dLife.
Yeah, I was going to ask you that question. However, why did you opt for the dLife course? But I think you've answered that very well. So I'll move on to another very important question that many of our people may want to know. How did you find the forum support, the WhatsApp group, the resources that you get, bundled along with the course? The 3,000 plus success stories that you have. So you search any condition and it will come up, and you can take your cues from there. If you don't understand something, there are mentors on the forum all the time, and they'll answer your long threads, short threads. For shorter queries, you also have WhatsApp. Then the access to recipes, the library itself, the 150 plus podcasts, the 2 metabolic health conference sessions. So how do you find all this along with just, the course? I mean, it's one thing to just do a course and be helped in doing that course. And it's another thing altogether to be, given access to so much more information all around.
Yeah, very rightly said. See, the course by itself is unique, but it doesn't end there. I see a lot more benefit coming in from the forum. I wasn't aware of the WhatsApp groups actually when I signed on. After I signed on, Anup added me to the WhatsApp group, and then I realized there's a very good resource here even. So I have actually had to ask doubts maybe only 2 or 3 times on the WhatsApp, primarily because I have this habit of first looking up online first looking up in the WhatsApp group or in the forum if what I'm going to ask is already been answered. And most of the time it was already answered. I wanted to know the relation between fasting, insulin, HbA1c. It was there. I wanted to see how what diet to prescribe in a patient with renal disorders. It was there. So everything is already kind of pre-answered, and uh, even say the brand recommendations of what supplements to give. So the resource is very handy. The resource is very accessible. It's just a wonderful. It's like having a friend online 24 hours. You can just log in, get any query answered in no time. And actually, one thing I would like to add is about the MHCs. The first MHC last year, that was such an eye opener because to get all these medical doctors to come on board and talk about certain things, that was really tremendous. That was really something. Uh, because see, no matter what, uh, I'm a homeopathic doctor, right? I'm not a modern medicine doctor, and uh, I'm established endocrinologist or a diabetologist talking about how diet will create changes in their life, in their life, with their health, with their overall lifestyle. That was quite an achievement. And there are so many times that I've and these resources not just available to dLife, but it's actually available to everyone on YouTube. So there are times where I've gone back and looked at specific videos just to learn, so because there was just so much to learn there.
Yeah, as I always keep saying that every MHC session, every metabolic health conference session is equivalent to reading 5 books or more. You have every question answered there by the top names working in the field of low carb and metabolic health. So yes, both the MHCs, both the conferences are great resources, and I think it's very well received and respected all around the world, and we have the credibility to have all these doctors attend the conference and make such an impact. So Sandeep, tell me, what would you like to say after you've gone through the entire experience of studying the dLife nutrition course? Uh, what would you say to those who want to enroll the course or thinking of enrolling the course, doctors like you maybe?
Sure. See, when I completed the course, I was writing the review, and then what I thought is what I'm going to say now. What I wrote then is what I'm going to say now, which is this course has a tremendous benefit for the layperson and as well as for the doctors. So when I started doing the course, initially a bit of the some of the stuff was a bit repetitive, but it was good that it was repetitive because I had read about that physiology back in 2001 or two. So thank you for that refresher. So the course has a lot to offer for the layman as well as for the doctor, not just in terms of what the basics of nutrition is. The basics of nutrition you can learn anywhere, but the course, the way it is designed is you learn how your how diet affects basically every part of your health, how diet affects every part of your life, and there is so much more that you gain from being a part of this course. I personally learned, for example, I also learned in the course what kind of exercises I could refer to my patients. I learned how I could market myself as someone who helps people with their metabolic health. These are not things that these are things which you usually learn by experience. So dLife is really a shortcut to learn a lot in a very short span of time. Any person who would want to enroll, I mean, if you're interested in metabolic health, if you're interested in nutrition and you want to enroll uh, for a program, dLife is probably the best choice, not just in India but maybe in most part of the world right now, just because of the tremendous value you get for the money you pay and for the time that you spend on it.
Hmm. Sandeep, another very interesting question. Have you been able to recover the fee that you paid for this course?
Uh, in monetary wise, maybe no, because I have not been professionally charging people for my advice.
Okay.
So I was always telling people, guiding people, with diet. But in terms of the satisfaction, 10 times over, 50 times over, maybe. Because at the end of the day, see, my patient will still pay me my professional consult. But I want to be satisfied at the end of the day that, yeah, I've made a difference in this person's life. And that is what I've been able to do now.
Hmm. Very interesting conversation there. For people who want to know a little bit more about the course, we are India's only legally tenable course in low carb nutrition and metabolic health. We are also CPD SO UK accredited with the global biggest 60 hours of credit. We are also the SMHP approved CNHE provider. The course gives free access to the dLife platform and lifetime access to the dLife course. There are 3,000 plus combined success stories on the forum, 2,000 plus original low carb keto recipes, 50% of which are vegetarian. There are about 150 plus podcasts, including the Metabolic Health Conferences 1 and 2. We have the largest content on low carb, not only in India, but one of the biggest in the world as well. In the course, we have 800 references, 200,000 words, 60 plus relevant videos, lifetime access to the course, and there is no recertification clause. There is a robust forum of discussion with our mentors and moderators. And we also have a 24/7 WhatsApp community, which encourages you to ask more questions, bond with each other, learn, and have so much fun. I thank you, Dr. Sandeep, for coming and speaking with me this afternoon. Your inputs are very valuable. And anything else that you would like to say, before you go?
So, thank you for having me here. When Anup messaged me and asked me if I was willing to give a review, I was more than happy to. I have nothing but gratitude for the course and for the people who run the course. And I wish that how my life has got impacted in a positive way by doing the dLife course. I wish that a lot of more people are able to join in and experience the same.
Yeah. Thank you so much. And this is Ira Thai signing off for now. I'll be back with another review of our course candidate who's completed the course. Until then, it's goodbye from